Changes in your fingernails can be an early whisper from your heart, signaling changes in oxygen levels and blood flow long before other symptoms appear. In this video, we will walk through 7 specific nail changes that seniors should monitor to understand their cardiovascular health better. Let's begin immediately with the first and perhaps most distinct sign regarding the shape of the fingertips. 1. Finger clubbing and the shape of the fingertip. One of the most established indicators of long-term heart and lung health involves a change in the physical shape of the fingertips and nails, known as clubbing. This is not a sudden change, but a gradual process that happens over years. It occurs when the tissue beneath the nail bed becomes softer and expands, causing the nail to curve downward more than usual. The fingertip itself may appear rounder or bulbous, resembling the end of a drumstick. This change is primarily related to the amount of oxygen reaching the extremities. When the heart or lungs are functioning with reduced efficiency over a long period, the oxygen levels in the blood may remain chronically lower than optimal. The body responds to this by altering the blood flow to the fingers, which leads to tissue changes at the very tips. This acts as a biological marker of how the cardiovascular system has been performing over the last several years. You can check for this at home using a simple method called the diamond gap test. This is simple to do. Bring the fingernails of your 2 index fingers together, back to back. Hold them up to the light. In a normal finger shape, you should see a tiny diamond-shaped gap of light between the nail beds where they touch. If there is no space and the nails press flat against each other, this may indicate early clubbing. Most older adults can try this safely. It does not require any special tools, only good lighting. If you do not see the diamond gap, it does not mean there is an immediate emergency, but it is a valid reason to discuss your heart and lung history with a doctor during your next checkup. It is a sign that the body has been adapting to oxygen levels for quite some time. Recognizing this shape helps you understand your long-term circulation. Second, splinter hemorrhages and red streaks. Here is another simple sign to look for on the nail plate itself. Sometimes, small red or reddish-brown lines appear vertically under the nail. These look very much like tiny wood splinters that have been caught under the nail, which is why they are medically referred to as splinter hemorrhages. These marks are actually tiny amounts of blood from damaged capillaries in the nail bed. In many cases, these occur simply because of minor trauma. If you bumped your hand against a door or worked in the garden, a small blood vessel might burst, leaving a dark streak. However, if these streaks appear on multiple nails without any recent injury to your hands, they can be an indicator of something happening within the cardiovascular system. The connection to heart health involves the heart valves. Occasionally, when the heart valves are not functioning perfectly, or if there is a minor bacterial issue within the heart, tiny clots can travel through the bloodstream. When these microscopic clots reach the very small, fine capillaries of the fingertips, they can cause the vessel to rupture, leaving a visible red streak. Monitoring this is straightforward. If you notice a single streak and you know you have been working with your hands, it is likely just a bruise. However, if you see streaks appearing on several fingers at once, or if they reappear constantly over weeks, it suggests a systemic issue rather than a local injury. This awareness helps seniors distinguish between simple bumps and internal signals. Checking your hands for these lines takes only a moment in the morning. It is a painless way to keep track of your capillary health. 3. Blue or purple tint in the nail beds. Another gentle adjustment helps with understanding oxygen delivery. The color of the tissue underneath the nail, known as the nail bed, should generally be pink in healthy adults. This pink color comes from the oxygen-rich blood flowing through the dense network of tiny vessels under the hard nail plate. When the heart is struggling to pump blood effectively, or if the lungs are not fully oxygenating the blood, the body prioritizes the vital organs. It ensures the brain and heart get enough oxygen, often at the expense of the extremities like the fingers and toes. When the blood reaching the fingers is lower in oxygen, it takes on a darker blue or purplish hue. This condition is known as cyanosis. It is important to differentiate between a temporary reaction to cold and a genuine heart signal. If you are outside in winter or handling frozen food, your nails may turn blue simply because the blood vessels have constricted to preserve heat. This is a normal, healthy response. The color should return to pink rapidly once your hands are warm. However, if the nails remain blue or purple even when you are warm and resting comfortably, it indicates that the blood arriving at your fingertips lacks sufficient oxygen. This can be a sign of heart failure or chronic lung issues. This is easy to observe in natural daylight. Simply look at your hands while they are resting on a warm surface. If the blue tint persists, it suggests that the circulation system is working hard to distribute oxygen. Noticing this color change early can help you manage oxygen levels effectively. 4. Pale or white nail beds. One more easy morning change is to check for paleness. Just as a blue tint indicates low oxygen, very pale or white nail beds can indicate a lack of red blood cells, a condition known as anemia. While anemia is often thought of as a nutritional issue, it has a direct impact on heart health, especially for seniors. Red blood cells are the vehicles that carry oxygen. If you have fewer red blood cells, the heart must pump harder and faster to deliver the same amount of oxygen to the body. This places significant strain on the heart muscle over time. For a senior with existing heart conditions, untreated anemia can worsen fatigue and shortness of breath. You can perform a quick check called the Blanche test. Press down firmly on one of your fingernails until it turns white. Then release the pressure. In a healthy circulatory system, the pink color should rush back almost instantly, usually within 2 seconds. If the nail remains white or takes several seconds to regain its pink color, it may suggest sluggish blood flow or low hemoglobin levels. This test works well for most older adults. It gives you a quick snapshot of your peripheral blood flow. Addressing this often involves simple dietary adjustments. Ensuring you are getting enough iron and vitamin B12 is essential for building red blood cells. Foods like lean meats, beans, lentils, and dark leafy greens support this process. When the blood is rich in cells, the heart does not have to work as tirelessly to keep the body energized. This simple observation keeps the body balanced and supports heart longevity. 5. The red lunula. Here is another specific visual marker to look for. At the base of the fingernail, many people have a pale half-moon shape called the lunula. It is usually most visible on the thumb and may be lighter in color than the rest of the nail plate. In some cases, this half-moon shape can turn a reddish or violet color. A red lunula is a less common but distinct sign that has been associated with deep cardiovascular issues. It typically indicates that there is significant congestion in the deepest blood vessels affecting the entire system. It can be associated with heart failure, where the heart is unable to pump blood forward efficiently, causing a backlog of pressure in the venous system. This sign is purely visual and does not cause pain. It is important not to confuse this with the cuticle or the skin around the nail. The lunula is part of the nail structure itself. If you notice that the usually white moon has turned dark pink or red, it is a specific signal from the body's vascular system. Most older adults can monitor this without any special equipment. It is simply a matter of noticing the color contrast at the base of the nail. If the moon is not visible at all, that is often normal and not a cause for concern. The warning sign is specifically the change to a red color. Identifying this helps doctors understand fluid status and heart pressure. This is easy on the joints and requires only a quick glance. 6. Bows lines and horizontal grooves. Another helpful step is to look at the texture of the nail surface. As we age, it is very common to develop vertical ridges that run from the cuticle to the tip of the nail. These vertical lines are generally harmless and are simply a sign of the nail matrix aging, much like wrinkles on the skin. However, deep horizontal grooves that run across the nail from side to side are different. These are called bows lines. These lines are essentially a timeline of your health history. The fingernails grow at a relatively consistent rate. When the body undergoes a major physical stress, such as a heart attack, a severe infection or high fever, it diverts all energy away from non-essential tasks like growing nails. During that period of intense stress, the nail stops growing. When the health crisis passes and the body recovers, the nail begins growing again. This pause leaves a distinct dent or groove in the nail plate. As the nail grows out, you can see this groove move up the finger. Because fingernails grow a few millimeters per month, looking at the position of the line can tell you when the stress occurred. If the groove is near the cuticle, the event happened recently. If it is near the tip, the event happened months ago. For seniors, spotting these lines can be a way to confirm that the body went through a significant strain. If you see these lines but do not recall being ill, it may suggest a silent cardiovascular event or a period where your metabolism was severely disrupted without you fully realizing the severity. This helps you track your health history accurately. You can do this at home by running your fingertip down the center of the nail. If you feel a dip that runs sideways, that is a Bow's line. It is a physical record of the body's resilience and recovery. 7. Yellowing and thickening. One more easy observation involves the thickness and color of the nail plate. While fungal infections are a common cause of yellow, thick nails, there is another cause related to circulation that seniors should be aware of. This is particularly relevant if the changes appear on all nails and are not itchy or painful. Chronic swelling in the hands and poor circulation can lead to a condition where the nails grow more slowly, become thicker, and take on a yellow hue. This is sometimes connected to the lymphatic system and the overall efficiency of fluid movement in the body. When the heart is not pumping efficiently, fluid can accumulate in the tissues, a condition known as edema. This stagnant fluid environment affects how the nails are produced. The growth slows down significantly. This slow growth leads to the piling up of nail cells, creating a thicker, yellowish appearance. It is often linked with respiratory issues or chronic leg swelling, but the signs can be visible in the hands as well. It is helpful to check the growth rate of your nails. If you notice that you need to trim your nails much less frequently than before, and they appear yellow without any signs of fungus, it may be a circulation issue. This fits into any routine. Simply noting how often you use your nail clippers can give you data on your metabolism and blood flow. Improving circulation through gentle movement and keeping the hands warm can sometimes help, but the primary action is to recognize it as a sign of systemic flow rather than just a cosmetic annoyance. This keeps the viewer comfortable and engaged with their overall health. Conclusion. Your hands are a remarkable diagnostic tool that you carry with you every day. By paying attention to the shape, color, texture, and growth of your fingernails, you can gather valuable clues about the state of your heart and lungs. These signs, clubbing, splinter hemorrhages, blue tint, paleness, red lunulas, horizontal lines, and yellow thickening, are not meant to cause alarm. Instead, they are useful signals that help you and your doctor make better decisions about your care. The body often communicates its needs through these small, quiet changes. Observing them requires no money and very little time, yet it offers a window into your deep internal health. If you observe any of these changes, simply bring them up at your next medical appointment. It is a proactive way to stay ahead of heart health issues and maintain your well-being. If you know someone over 50 who could benefit from this, share this video. and subscribe for more simple health tips.